Hi, I'm Dr. Mitzi Joy Williams. I am your board certified neurologist and multiple sclerosis specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Today, I'm going to talk to you about a topic, fatigue, which is very important. It's considered an invisible symptom of multiple sclerosis. The reason we call these symptoms invisible is because they often can cause a lot of disability, but people don't recognize them as symptoms of the disease. For instance, if someone has difficulty walking or difficulty with their vision, it's very easy for people to understand that as a form of disability or related to MS. But when we talk about other symptoms like cognitive problems or fatigue or bowel and bladder issues, oftentimes people don't associate that with the MS, and they also don't recognize that these symptoms can cause a lot of interruption of your daily activities. So let's talk a little bit more about fatigue. Fatigue is a symptom of MS. We're not really sure what part of the brain causes a person to have fatigue, but we do know that it's related to the accumulation of many lesions or spots in the brain over time. Fatigue related to MS is not your simple run-of-the-mill, I had a long day type of tired. It's an overwhelming sense of tiredness, and people often describe it as a heaviness. They may say, I have a certain amount of energy, and if I use it up by 10 o'clock in the morning, it's gone. If I can stretch it out until 3 p.m., then I can do that. But once I hit that wall, I just can't go anymore. Sometimes doing simple things like taking a little nap will help reset it, but oftentimes people may have to lay down and not do any more activities for the rest of the day. So how can we combat this fatigue? What are things that you can do to empower yourself to live better with MS? I'm very glad you asked. So I'll tell you 3 tips to help combat fatigue. Number 1 is making sure that you get enough sleep at night. Oftentimes when we're in our 20s and we're young, we think we can pull these all-nighters, we can do all of this activity, and we can just keep going. However, with multiple sclerosis, if you do too much, you often pay for it on the back end. And whether that means you may be out of commission for another day or sometimes a couple of days, depending on how much activity you do, you want to really make sure that you're able to do some of the things you want to on a daily basis. And that leads into the second tip, which is managing your energy. It's important to manage your energy. I often say that MS is an adjustment sentence, meaning we have to adjust the things that we do. I have many patients who say, Dr. Williams, I'm so used to just doing everything. I'm used to going and going and going, and I can no longer do that. And that unfortunately is a part of the disease, but we can find ways to manage that energy so that you can be effective on a daily basis. So if you have a big activity in the evening, you can take a rest earlier in the day so that you have the energy to complete or fulfill that task. Also, asking other people for help is a big, important way to manage your energy because they can often do some of the other tasks that you used to do to take some of that burden off of you. And then finally, talking to your doctor about managing your medications, because often many of the medications that we use for other symptoms of MS can cause fatigue. So making sure that you're looking at that medication regimen with your physician or your healthcare team and adjusting that as needed will also help to improve your energy related to MS. So thank you so much for your time. If you want more information, please go to my website, www.joylifewellness, JOI, lifewellness.com, or visit my YouTube channel, Dr. Mitzi Joy MD.